Hello, everyone. I hope you are doing well today. I wanted to hop on and do just a quick video recording to introduce myself, to welcome you guys to the course, and to go over just some brief content for week one and week two. So, my name is Dr. Megan Hampton. I am the MSW Program Director. I have been working in academia now for a little over 13 years. And I'll do an introductory video as well about myself for week one. But I have been independently licensed as a clinician since, I actually just had to look at my license stuff since 2005. So goodness, that is kind of embarrassing. But needless to say, that clearly makes me qualified to be able to teach this Practice 3 course. We are going to cover a ton of fun content in this practice class. You guys clearly have had Practice 1 and 2, where you're learning kind of basic skills or have already learned basic skills related to providing therapeutic interventions or interventions with clients. This class, we're going to kick it up a notch. We are going to focus on some theoretical perspectives, actually probably quite a bit of them, and also I want to see you guys doing a lot of these things. So this is a class, and I should say my teaching style is I am very well aware that you guys know how to write in APA format. I am very well aware that you guys know how to find peer-reviewed references. But what I want to see in this specific class is I want to see you engaging. I want to see your nonverbals. I want to see your, you interacting. I want to see you using those critical thinking skills. As you're engaging with clients and showing me your practice behaviors and videos. So I'm excited. I've taught this class before. I actually built this class, and I think it's just the content is just really, really important. Okay, so the book that we're going to use for this particular class, let's see which camera it is as this text. Mine looks a little bit different because it's the instructor edition. You are going to need this text to be successful in this course, so please grab it. Um, let's see, you've got your APA manuals by now. You've got that DSM-5 hopefully by now as well that you'll need in this class, or you'll need to be able to reference, materials related to the DSM-5. Okay, so let's talk about week one, and then we'll probably get into week two as well. Okay, so week one, we're going to focus on a discussion post that where I really want to see your opinion backed up with some facts about the importance of evidence-based practice. Hopefully by now, this term is something that is very familiar to you guys. The importance of evidence-based practice is just so integral in the therapeutic process. Our profession historically has been discounted, right? It's not hard scientists identify the helping professions as not being a science. So the fact that we have practices that are put in place, that we have evidence that shows that they are clinically sound, that we have we have been able to show that they work, is something that is vital, not only to the field of social work, but also to client care. So week one, we're really just going to focus on this. You will notice that there is a request for you guys to respond to another colleague. That is not necessary in my classes. Please, if you read something and you're like, oh, this is phenomenal. I want to engage in a conversation. Please do. I am not about busy work for you guys. I want most of the content that we have in this class to be meaningful. So please do take the time to read through your peers' discussion post, because heaven forbid you learn something, or maybe, are able to kind of learn a different perspective. Okay, so from a content perspective, there you're going to see that there's a lot of content that's packed into this specific course. Okay, do I expect you to um, digest 100% of this content? Absolutely not. Do I hope that you will kind of have an overview of the subject matter? You'll use additional resources. For example, like in this one, we've got a podcast, and then we have a YouTube video that I want you guys to watch. So hopefully in this situation, you guys are being able to get an overview. And let's say that, week 10, you're like, oh, I need to revisit. Then you might go back and do a deep dive in content, for example, related to evidence-based practice. Um, I am actually going to do my live session for you guys next week. I know I have heard constant feedback from students that it's difficult to be able to navigate all your professors, all new content, all that good stuff week 1. So I will actually meet with you guys week 2. My office hours will be on Wednesdays at 2:30 Pacific. So I will put a Zoom link in the Canvas shell that you guys can hop on. And then of course I'm available when you guys need me by appointment. Okay, so let's dive into week 2 as well. So week 2, we are going to focus on the stages of change. Hopefully you guys are familiar with the concept of stages of change. If not, then then this is a good introduction for you. So we've got some readings, we have some videos, and then some additional resources. I am a hands-on person. I like to watch. So if I need to learn how to do something, I'll often see if there's a video. So that's why you'll see in my teaching style that there are usually a couple different formats, right? Some reading, some watching, some listening. So so get in here, take a look at these. Stages of change are just so unbelievably important when working with clients. For example, so I'm getting ready to present on at a substance conference, and what I'm exploring, and have been exploring, is the correlation between substances and domestic violence. Substances specifically performing enhancing medications. So whether that be males, predominantly males with low testosterone that are prescribed a medication, and then all of a sudden their spouses or significant other family members are victims of domestic violence. So that's what I'm exploring. Okay, and so what we often know about survivors of domestic violence is it takes sometimes a couple times, sometimes more than that, sometimes it takes years for victims to be able to leave that situation, right? So if we think of that kind of caveat, that case study, when we're looking at stages of change, and let's say, for example, you're the therapist, right? Your third or fourth session with this person, they might divulge that they are victims of domestic violence. You're going to have all of those conversations, including one which might, question, are you in a situation to leave, or a position to leave? Can you? Are you going to stay? If so, what are you going to do to make sure that you're safe? Okay, so that's kind of that initial conversation. It's important to identify, or try to identify, what stage of change that particular person is in at that time, because that's going to inform your therapeutic alliance and relationship with the client. If they're ready to go, they're over it, then of course you're going to support them gung-ho. If they're not, because they're kind of in that contemplation stage, then that conversation looks very different from a therapeutic perspective. So that's just kind of one example of why it's so important for you guys to understand this. Of course, this is applicable to any decision making, changing a job. Oh my goodness, my brain just went. So changing a job, substance, weight loss, exercising, all of this good stuff. So nonetheless, week two, we're going to do kind of two things. So first of all, I want to just kind of do a deep dive, or not a deep dive, let's do a little dive into populations that you guys are interested in working with. And then populations that you're like, no, I'm definitely not interested in working with these guys at all. Um, I bring this up because when I was working on my bachelor's degree, I had a professor that asked me to write down the three populations that I would not work with. And the first population was offenders. So those that were sexual predators. I had no interest in doing that in any way, shape, or form. Well, fast forward, goodness, 15 years, or less than that. I guess I was probably independently licensed for 5 years. I've been working with this population now for 15 years. So that's actually an area that I'm trained in as sex offender treatment specialist. I have done countless interventions for the courts, countless assessments as well. So I want to kind of, if this question has not been posed in the program, I want to go ahead and ask you guys this. And then additionally, what are three populations that you would like to work with? Okay, so then we're going to move into this paper related to theory of change, or actually, it's a video recording. So I want to know, how you believe people change. I want you to provide a real life example of how, someone in either your personal or professional situation has changed. Um, Give me some scholarly articles, okay? So support the evidence. For example, if I had a bias related to offenders, and if they can change, then I would want to go back to the science and say, with this recidivism rates for those that offend are generally high, and here's the evidence behind that. Um, and then also, I want to see kind of like a population that you think that you might want to work with. Okay, so let's say, children, veterans, and then tell me at least two techniques that you can utilize to be able to facilitate those stages of change. Okay, so this is going to be a video recording. You can put it in a PowerPoint presentation, whatever you guys tend to prefer, whatever you guys think that you like. Okay, and then this is the discussion post, which comes up as well. Let's see. Okay, that's it. That's all that I have for you guys for this week. I will continue to do lectures for you guys, continue to be here to support you guys. And I'm excited to learn with you, and let me know what questions that you guys might have, or things that you're just not superly confident in as far as course content. Okay, I hope you guys have a great day. Bye.